like that. And what we're going to say is just going to be as groundbreaking and as exciting as that. All right, so I'm Dr. Scott Hoar. Okay, I'm going to talk to you about preventing injuries and just staying healthy and that sort of thing. I do want to thank Alan and Sika for inviting me, and thank you guys for being here. This is a great, cool little opportunity. In case you were wondering, I did just say my last name was Hoar. Okay, that's Hoar. All right, Scott Hoar. That's my name. It's pronounced that other way that you don't. Well, maybe you do want to say it, but it's spelled a different way. So it's a lot of fun growing up with a last name like that. But all right, so I'll tell you a little bit about myself real quickly. I was born in Buffalo, New York. I was raised in Northern Virginia, right outside of Washington, D.C. for the most part. And I was a big jock growing up. I played all sorts of different sports. And I continued with baseball at Radford University in Virginia. And it was while I was at Radford, I injured my low back and my pelvis. And I went to see my doctor. And I went to see an orthopedic doctor. I went to see a physical therapist. I went to see just everybody I could think of to fix me up. And I didn't have much luck. And then the athletic trainer at my school, they said, well, why don't you go see this chiropractor? And I kind of said, chiropractor? Are those guys like quacks or something? Like, why would I? And I said, okay, whatever. I went anyways. And this lady was able to feel how my pelvis, how my hips were not moving and fix it. And it fixed up my injury, and I just knew, like, leaving that room that day, I want to be a chiropractor. That was the coolest thing that I'd ever experienced, and I want to do that. So fast forward, I am a chiropractic physician at Health Fit Chiropractic and Sports Medicine right here in Boca Raton, and my practice specializes in the treatment and prevention of injuries for active people, all the way from young kids growing up to NFL athletes to the aging populations that we have here in Florida. So that sort of thing. So that's a little bit about me. And I kind of wanted to get a feel for you guys where you're at as far as this is the 90-day challenge, correct? And you guys are obviously health and wellness and fitness is important to you. What are some of the things you guys are dealing with? What are some of the things you were hoping to get covered? Do you have any injuries that you're struggling with right now? What I want to hear from some of you guys. What's going on? What's your name? Benny. Okay, Benny. Uh-huh. Uh-huh. Okay. Right. Okay. So we got shoulder, we got elbow, we got ankle, we got all sorts of stuff, right? Who's got like shoulder pain? Does anybody else deal with that? You got shoulder pain? We're not talking to each. This is a no. Never mind. She's got shoulder. She's a patient of mine. So, anybody else with like low back pain? We got a couple of low backs. Tell me, how long have you been dealing with low back pain?
It's not like an everyday thing, but it's just either neck or like between the shoulders and lower back.
Sure.
A lot of it's probably
Right.
I would say I don't know, I can't.
Okay. Does anybody else deal with that sort of thing? Hand pain? Okay. Anybody hand pain? Arthritis with your wrist? Rheumatoid arthritis. Do any arthritides, any other arthritis or anything like that? Yeah. Oh, that's fun. Okay, good. All right, so plenty of things we're dealing with here, okay? Plenty of injuries, plenty of obstacles to our own health and fitness, okay? And we're going to talk about minimizing those as much as possible. So what I wanted to kind of point to is who's ever had a splinter in their foot as they're walking around? What happens when you have that splinter? It hurts, yeah, that is true. There's pain. And so then how do you walk as a result of that? You kind of change your gait. You kind of alter how you do it. And you kind of do that even without thinking about it, right? And that's kind of that's an important principle to remember with our body and with our movement, when we're in pain, we're going to, without even thinking about it, change the way we move our bodies so we can avoid that pain. Okay? And that, like I said, that happens whether we're aware of it or not. Now, how about, has anybody had like a walking cast or a walking boot or something like that? Anything like that? What did you notice about the rest of your body as you walked around with that cast? Yeah. Uh-huh. Okay. So you're saying you started altering the way you moved and it started chewing up other parts of your body. Okay, great, perfect. That's another principle I want to kind of point to. When we have pain, okay, or if we have like a stiffness or a mobility problem in one area of our body, we are going to compensate how we move, whether you're aware of it or not, and that is going to chew up other parts of your body, which opens the door to more injuries, to premature degeneration, arthritis, all that sort of bad stuff. Okay? Does that make sense? All right. So over here I've got mobility stability man. Okay? Now, mobility stability man, the green dots right here, okay? These are areas, can everybody see that? Yeah? No? I'm not hearing much. Yeah? All right. So the green areas are areas in our body that we want to be as flexible as they can possibly be. Okay? And then the red areas we're pointing to, we don't really want them flexible at all. Okay? We want them to kind of limit their motion and be relatively stable. Okay? Now, here's where the problem happens. When we start losing the flexibility in those green areas, okay, due to injuries, okay, due to poor posture, due to lots of different things, we'll lose the flexibility in those green areas, and then we'll actually compensate and we'll steal flexibility from these red areas where we shouldn't actually be moving all that much. And when we put flexibility in areas that shouldn't move, okay, that's when you open the door to the injuries, to the degeneration, to all that sort of thing, okay? We have this compensational nature in our body, and it's kind of in a pattern like this, okay? If we have a stiff upper back or stiff shoulders, okay, we're going to start moving our lower neck too much, and it wears that area out, okay? Does that make sense? Now, given that we talked about shoulder pain being kind of a common theme here, as well as low back, that's always a kind of a common theme. I'm going to concentrate on two specific areas today in my little time to talk to you. All right? Number one is thoracic spine flexibility, okay? Your upper back, all right? And this is so important to keep this as flexible as possible, okay? So we can minimize the stress on our shoulders, our neck, and our low back. If you notice in my little diagram here, all these kind of surrounding areas, all right, they get impacted out of your thoracic spine, your upper back being stiff. All right, so we'll do a quick little example here. I want everybody to slouch in their chairs. Kind of scoot your butt back, forward shoulders. You guys are doing great. You're pros at this position. Very good. So what I want you to do at this point is raise your arms up as high as you can. Okay. Good. Not bad. Perfect. All right, now what I want you to do is extend your thoracic spine. Okay, kind of open up, bring those shoulders back, and once again, raise up your shoulders as much as possible. All right, what'd you guys notice? What's that? Right. What else? No, that's it. That's pretty much it. You can lift your arm. So it's easier to move your shoulders, okay, with less stress on them, okay, when your upper back, when your thoracic spine is able to move more flexible, okay? And that applies in this little example. You can see how it relates to your shoulder range of motion, but it also relates to your neck, okay? The people that we talked about that are having discomfort and pain right there, and it relates to the low back as well, okay? So that's one quick region we want to concentrate on. The other region, I would say, would be kind of like your hips and your hamstrings, okay? We want, you can see in the diagram right here, we want the hips as flexible as possible, Okay, when we're doing like a deadlift or a squat or any sort of movement, or even like walking around throughout your day, you want your flexibility to come from your hips. You would not want it to come from your lower back. Okay, that's why when you're taking a class here, Alan is telling you not to round your back. Okay, keep the back straight, minimize the range of motion that comes from there, and that way you lighten the load on it. Okay, so let's do an example of that. So who's the shortest person here? Come on up. All right, good. What's your name? Chris. How you doing? Thanks, Chris. Okay, so what I want you to do, Chris, is try to put your foot on top of that right there. Okay, good. So lower it. What I want you to all to pay attention to is, do you see the flexibility coming from Chris's hip? Okay, or are you going to notice any motion coming from this part? Okay. Shh, he hasn't done it yet. All right, go for it. Good, good. So what you saw him doing, it was pretty subtle. He went up with the hip flexion as much as possible. And then he actually kind of rotated, okay? He was trying to see how he could get his foot up as high as possible. And then he just straight up kind of leaned forward with his low back, okay? Added motion to where we really don't want motion in order for him to compensate to get his foot up in the air, okay? Thank you. Good. So, why does this matter? Okay, is he climbing up on crazy things like this all the time? And is that why we care about this? No, absolutely not. What that's an example of, though, is when you're doing maximum hip flexion, or really when you're just initiating using your hip at all, he has a substitution pattern where he really puts more stress on his low back more than he should during hip flexion. And hip flexion happens every step, okay? Do you see how that relates to his everyday life? Not just like a crazy movement like that, but how he can't move his hip in an ideal manner, and that's going to beat up on his low back. Does that make sense? Okay, good. All right, so at this point, what I wanted to do real quick was to take you guys through a couple of movements, okay, and then take you through a couple corrective exercises, or what we call preventative exercises, to leave you more flexible so that you're less likely to beat up on your system to compensate and open the door to injury, okay? So, you know, a lot of us are wearing different things. If you feel comfortable doing this, go for it. If you don't feel comfortable, don't worry about it. But what I'd like you to do is all stand up. Good, good. All right, so at this point, depending on if you have room with your chairs, what I want you to do is to just put your hands over your head, put your feet about shoulder width apart, keep your heels on the ground, and I'm going to ask you to squat as deep as you possibly can. Good. All right, good. And some of us, we notice our heels are coming up. If you want to come up, you can come up. And some of us, our heels are coming up, right? Some of us, our butts aren't going down below parallel, and I wanted you to squat as deep as you possibly could there. Some of us are not going to parallel. Some of us are kind of leaning forward with our upper body. Some of us feel like we're about to fall. Would that be accurate? Did some of you guys experience some of the things I just said? What did you guys notice? How did your squat feel? You were shaking your head no. You didn't feel any of the things I just said. Your pelvis was what? So he felt strain in his pelvis. Did anybody feel strain or tightness in any specific area while they were doing that? Upper back? Sure, good. Not being able to keep the arms up. All right, perfect. So what I want to do now, depending on space and cleanliness and what you're wearing and all that stuff, I'd like us to actually lay out on the ground and do a corrective exercise. Okay? You guys down for doing that? All right, cool. Chase, can you be my my example? Can you show them can openers? All right, good. So what I'm going to have Chase do is, this is an exercise designed to increase, you can do it, to increase the flexibility of your upper back. Okay, so she's going to lay on her side. No, that's not can openers. Lay on your side. Good. Bring the top knee in front. Good. So I actually want you guys to do this, so take a look. So she's going to have one hand down, and what she's going to do is pin her knee and her hand to the ground, and she's going to rotate as far as she can till she attempts to touch the other side of the ground while looking at it. So go for it. All the way, and she's straining, and then back. Good. And go. That looks fun. Good. So make sure you turn your eyes as you do this, okay? So look at your thumbnail as you're doing it, and breathe and relax. We're not going to get any increases in our flexibility or in the quality of our movement if we're straining and doing that sort of thing. You guys don't want to try it? No? Kika, where's the flexibility at? Back at the house. Turn your eyes now. The eyes are very important. Good. Keep that knee pinned. Okay, do not let it off the ground. And exhale and breathe. Good. Good. So this is not a problem for you. Good. All right. Bring that knee up just a little bit more. I know you're in a dress. And exhale and all the way. So do 6 or 7 reps. This is a mobilization, okay? We don't call this a stretch. We're not stretching muscles here. What we're doing is opening up joints. Good. Good. Keep that knee all the way. Don't let it come up. Yeah? Who's noticing a difference from one side to the other? Yeah? Okay, an asymmetry like that is one of the top predictors of upcoming injuries. When you have asymmetries, so switch your legs. There you go. Good. Keep that knee all the way down. Don't let it come up. It's more important to me that you keep that knee pinned on the ground than you actually reach your hand to the floor. Okay? Good. All right, good. Now I have another exercise for you, okay? So everybody come back real quick, and then we'll come back into these places where you can do it. Actually, everybody can just look at me from right here, right? All right, so what I'm going to do now is an ankle mobilization, okay? On my chart over there, it says the ankles, you want them to be as flexible as possible to reduce tension on other parts of the body, okay? So what we're going to do is we're going to get in a split stance like so, all right? And what I'm going to do is I'm going to grab my back knee, okay? And what you're actually going to do is rock your knee forward and backward, okay? What we're doing is we're mobilizing this back ankle. I want you to rock it as far forward as you can until you feel a pinch in the front of your ankle. Keep your heel on the ground. Do not let it come up. And make sure your toes are directly forward and not spun out to the side. Good. Do you guys feel that pinch in the front of your ankle? If not, push harder. Yeah. Yeah, you're doing it perfect. So I want you to do the back knee, not the front. So kind of sit back. Bring this left foot forward just a hair. Grab this knee and sit back and rock this forward like that. Perfect. Good. Back and forth. All right, what are you guys feeling? Does anybody feel pinching in the front? Can I see yours? Do you feel pinching in the front? Who doesn't feel pinching in the front? Okay, good. Do you feel pulling in the back? What's that? Tightness in the soleus. It's getting a little specific here. Who feels tightness in the soleus? Goodness gracious. Good. How are you doing? Tightness in the back? Good. Okay, good. Did everybody do both sides? Okay, good. Now what I want you to do is we're going to try your overhead deep squat again. Okay? So wherever you are, put your feet shoulder width. Put your hands overhead. Keep your heels on the ground. Try to stay as upright as possible and squat as low as you can. Kika's is better. That's for sure. All right. Come on up. Do a couple of reps. What I want you to think about, who's going deeper? Who's feeling better? Who's staying more upright with their hands? And who, it made absolutely no difference for. What are you guys noticing? I want to hear some feedback here. You're noticing more flexibility? Yeah, that's a good squat now. That's great. Who else? What? My knee pops. Okay, that's another issue for another day for us to deal with. Very good. How is your squat different? If it's not different, tell me it's not different. What? Not much of a difference. A little bit more upright? Great. Cool. Do you feel as much strain in those areas? You said you felt strain in the pelvis? Okay. Okay, so you've got an underlying injury to actually deal with. Okay, good. Any difference for you two? No. Not so much. Not so much. Okay, good. All right, so come on back to your seats. Thank you very much for obliging me with that. All right. So we noticed a couple of things, right? We noticed we were able to, some of us, not all of us, okay, were able to be more upright with our spines. We were able to sink deeper into our hips. We were able to squat better, okay? Now, how does that relate to us in our real lives and to what really matters to us, which is what? Not injuring ourselves and being healthy, right? How does that relate? Can you guys think of any way?
Sitting to standing.
Yeah, going from sitting to standing. That's a perfect example. Picking up something off the floor. Picking up a grandchild or a baby or something, or groceries or something like that. Okay? What's that? Tying your shoes. Oh my God. Yeah, tying your shoes. That's a big one. Um, right. So I showed you the example of a squat right now. But and the squat is important, especially for when we're working out and stuff like that. But more than anything, it just gives us a snapshot of how well we move our bodies throughout our day, every day. Okay? And so what I'm suggesting is preventative exercises like the ones we saw here can really make a difference for the way you move your body to prepare you to stay injury free, okay, and be happy, healthy, and all that good stuff. All right? Okay, that's it. That's my little talk. Do you guys have are we doing questions later or questions now or whatever? All right. Do you guys have any questions or anything specifically you were wondering about?
Just curious, is there a difference between a chiropractor and a chiropractic physician?
In the state of Florida, no. My official every chiropractor you know in the state of Florida is officially a chiropractic physician based on the Department of Health. Yeah.
Do you recommend doing those exercises every day, like to strengthen?
I absolutely do. Now those are just two examples. There's millions of different preventative or corrective exercises out there. I absolutely recommend you do them on a daily basis, and specifically, I recommend you do them right before a workout. Okay, because a workout is when you're going to put more stress on your body than throughout your day. So the more flexible and the more stable, the more controlled you are with your movement before a workout, that's the most ideal time to have it.